How to report a CT head scan. Normally, CT head is a non-contrast scan mainly done for a stroke or any head injury to look for any intraaxial or extraaxial bleeding. So before we start reporting, we have to make sure that we increase the slice thickness to 2.5 millimeter and change the window to brain window. Then we will go first at the top. Make sure you are not missing anything at the top. Then come down slowly, and when you come down, try to follow one side at a time. So first we will follow right cerebral hemisphere. Go down slowly, look for gray white matter differentiation, how nicely the gray matter is running around the sulci and the white matter is inside. Look for the differentiation, it should not be lost anywhere. Look for right cerebral hemisphere, come down, come down, come down, keep looking at the temporal lobe here and finish it. Now go back at the top again. Look similarly at the left cerebral hemisphere while keep looking at the sulci. There should not be any effacement. Look at the gray white matter differentiation. Keep looking, go down, look till the bottom. When you have gone down, come to the maximum and then look at the spinal cord or brain stem, and then slowly start coming up and keep checking the brain stem. Remember, brain stem will look slightly darker or less dense as compared to remaining brain because of the physics, what we call as beam hardening. And then keep looking up, look at brain stem, look, come to the top. Then go down again, look in the back, look at the cerebellum. You can look one side of the cerebellum at a time, come down, look at the other side of cerebellum, come up. Okay, so we have covered both the cerebral hemisphere, we have covered brain stem, we have covered cerebellum. After covering all, go at the top again. And stroke or lacunar infarcts are very common in the area of basal ganglia and thalamus. Look at these areas once again to make sure you are not missing anything. So look at the insular cortex, look at the internal external capsule, look at caudate, thalamus, lobus pallidus, putamen on both the sides, and make sure you are not missing any stroke in this area. After doing the coronal image, you have seen all the brain. Make sure you do the same in the sagittal. Look at the whole brain in sagittal, and make sure when you are doing sagittal, look in the center, look at the ventricular system and the basal systems. You should not be missing anything in that. Basal system should be patent, there is no tonsillar herniation. Then you see the coronal one, then in coronal you can see for any tentorial herniation. You can again check that you are not missing any stroke or anything. After doing everything, go in the axial, go to the F5 bone window, look from the top to bottom. There should not be any fracture. Look at the sinuses, there should not be any opacity, any inflammation or anything. Look at the mastoidea cells, they are not missing. Go down to the bottom, change to sagittal, look at the bones once again, and come back in axial, then change the soft tissue window and go down and look around the soft tissue. There is no normality around here. Go at the top, look around the soft